All right, so welcome. Today we are going to be talking about kind of just overall transformation, the reason that we use the word prevention and how that's different, some examples of how really sticking to a plan and a program that's proven can make change no matter where you are now. This is our Take Your Health Back Now podcast for March 22nd, 2024, if you're watching the replay. If you are here live, we do have the chat up, so I will keep an eye on that if you have any questions or comments while we're live here. So we are just going to jump in.
Right. So, yeah, we just really wanted to talk about how, because I guess the whole thing stemmed from the fact that everyone that's having symptoms of whatever kind they are, for them, people feel alone in their situation, like they're the only one. That's a big one for, we hear it every day, all the time. Everybody feels that same way. And so we just wanted to kind of do this podcast to show that no matter what you're experiencing, it kind of brings together what we talk about all the time. So we're always talking about no matter, each person has individual symptoms. We were talking about that in our last podcast with our trees, but the roots are all the same. Or if you've seen our talks on the causes, the cure, it's the same thing. You've got the environment or lifestyle diet that comes in and then causes metabolic dysfunction, which then causes symptoms. So kind of at the end of the podcast, I just want to go through and show you several examples of different stories, different people, different ages, different, male, female, children. They all had completely different issues going on.
Right.
The exact same thing fixed it. Our whole conversation about the causes, the cure, fixes no matter what you have. So
right. And if you haven't watched either our talk from a couple years ago that we did on that, or the more recent podcast we did, I think it was January, one of the first ones of the years, you can go back and listen to those. But we have got a little bit of feedback from those that it's a big concept and people have little questions. So hopefully this will give you a little bit more detail, a little bit more clarity on that concept.
Right. And you definitely need to know the concept, and we're not going to go into that so much today, but we're going to show if you apply the concept, no matter what symptoms you have, it will resolve them. Okay. So, and then I was thinking this morning about how, always, especially today, that's why I was thinking about it, but always our podcast and actually our books that we've written, everything that we do, all the information we give you is always about how to live healthy in an unhealthy world. Even this poster, that's what it says. That's the whole idea, because this unhealthy world we're living in is what's causing all of these problems that people are experiencing. So that is our goal, always to give you information for that. And then also so that you can choose. And then if you want to choose to take control of your own health, that's our goal. So that's what this podcast is about. But always our podcasts, our videos, everything we do, that's what it's about. But you have to choose. And then I wrote down that information alone does not cause a transformation. So there's so much noise out there and information, but that information is not going to cause you to get to that transformation that you are desiring.
Right.
First of all, you have to make a choice. That's the first step. We talk about that a lot. You have to make a choice to take back control of your health. You have to make a decision. You have to make a decision to work with someone. You have to make a decision to invest in your health. All of those things, which are action. You have to take action. So we can give you all the information in the world, but if you don't take action, you're not going to get that outcome that you want.
And a lot of people get stuck on that stuff. They want to know,
Right.
and they're looking for, that one magic answer. Like everyone wants give me one thing that I need to do that's simple, easy, and quick. And you will be researching for a very long time if that's what you're looking for. There's not going to be it's not a yes or no. It's not a simple do this one thing. It's a process, and you're going to get so many people telling you so many different things if you're just looking for a piece of it. You'll get a piece, but you have to look at the whole thing. And I don't think that there's a Google search that you're going to be able to put in that covers that whole thing. So you're going to be finding a piece here, a piece there. And even if you take some small actions, you might not think you're getting the results. So now you're going to keep looking for someone else, looking for something else, looking, all the time. So
product or that
yeah,
medication or that supplement or that whatever it may be. And another thing that people tend to do that kind of goes along with what you were saying is everybody's looking for that one cause.
yeah, exactly.
And that's what they're constantly researching. They're constantly searching. And especially people that have not gotten answers with conventional medicine. Now they're researching on their own, but they're looking for that one cause of their symptoms. But there is no one cause. It's kind of like Jenny said, there's no one solution. There's no one cause. So that's a main point, definitely, to get across and understand. And that's a hard one for people to let go of, but there isn't.
But it's why, like we were saying at the beginning, and we'll talk about that, there's also not just one symptom. Like we have people, they're not presenting in one way. People we work with are all unique and special. They're their own tree, but we can help them transform with the same process because we're looking at everything. It's all of the causes for all of the symptoms, not just one issue or one solution.
Right. And with us, and I'm sure that there are a few, I know of one other a doctor that does something kind of similar to us, but I don't think there's very many people that do this. And of course it is what we do. So we tend to talk about what we do.
Our own, yes.
Right. But for us, I'm sure Jenny and I have been at this for 2 decades now, but we knew the causes, which are the environment, the lifestyle, the diet that people are experiencing. But for our system and our programs that we have, we wanted to really do them on case studies because people get so ingrained in that, and maybe that's because of conventional medicine. They get so ingrained in that, show me the science, I'm going to keep doing this until you show me the proof that this is bad. Or, you hear constantly, follow the science, follow the science. So we, even though we knew what was causing the issues, we took a lot of time and research over many years, collecting data in our practice and, making case studies so that we could say, here's the science, here's the proof, this is the truth. There's no disputing it when you have that. We think we know it's all of these environmental factors coming in that are causing this, but we didn't necessarily have the proof. But when you do it this way, you have the proof, so nobody can argue with you. You just can't.
Right. And it's not just we don't want people to argue with us. We like having it at all. But we wanted to ensure that we were getting consistent outcomes from everyone so that we could offer. Our goal is really to help everyone transform so that they can be in control of their own health. They can thrive, they can feel empowered. That's our goal. So, we have done this over the years in a couple of different iterations, and we have found the best way that works for the most amount of people at the lowest cost. And that's really what it is. And, so it can be available for everyone. You can start from, a place of lots of time and lots of money and spend all that energy and money and probably get to the same solution, but it's not as efficient. So we really wanted to make sure we had all that information that we could use to make this the optimal way to get them.
Right. And here's another analogy. I feel like now I need to throw an analogy with every podcast because I do it all the time. But just an analogy I use all the time with this. And again, it's not just our system. It's anybody that has something that they have proven results with, a system, if you think about a system, is like a recipe.
Yes.
So if you've worked with us before, you've heard me say this, but it is. So any system is like a recipe, because if you do all the steps, you're going to get the same outcome every time. So it doesn't matter what you start with, the ingredients, you just do the steps, what is in the recipe, the way it's laid out, all the directions, and you get the same result. So that's why it is more optimal, like what Jenny was saying, to use somebody's system that they've spent a lot of time developing. So, and I wanted to also say, I mentioned about the information does not equal transformation. So when you're trying to get healthy, I think a lot of people get stuck on feeling better. And so that's why people tend to go with a medication or a surgery or these magic products that are out there now, that kind of thing, because it gives you instant gratification, whether it's you look better or you feel better, but it's not transformative, if that makes sense.
Or even you just feel like you have an answer, even if it doesn't make you feel or look better, you feel like you're doing something.
Right. Yeah, that's a big one too for people. But, to really have a transformation. So if you think about what that end goal is, or, how you really want to feel, how you want your life to look, because it's a lot more than just how you feel, what you're able to do, all of those things, that's a transformation. You are transforming your life. It's not just ooh, I feel better. Ooh, I look good in a bathing suit today, that type of thing. So think about health as a true transformation. And that's why it's a lifestyle change, not just a quick fix, if that makes sense.
Right. And that's why the lifestyle is the cause and the lifestyle is the cure.
Right. And here's a good example. I was telling Jenny right before we got on here, I saw that, I'm not sure who said it. I didn't quite catch if it was the CDC or a pharma thing. I think it was more like pharma is saying it. But they're saying that metabolic syndrome is the new AIDS epidemic. So if you think about, first of all, when AIDS first came out, that was a scary, scary thing. I mean, that was, talk about fear. I was a kid and I can remember being so scared. Like I was scared to use a public restroom. I didn't quite understand what that was, how you got AIDS, but I was afraid to go in because I thought I would get AIDS. And what everyone, at least my age, and I'm sure adults too, thought that if you got AIDS, it was like a death sentence. There was nothing you can do. So for them to be saying metabolic syndrome is the new AIDS epidemic, in people's minds, that immediately says there's nothing you can do and you're going to die, basically.
Right. Except if pharma comes up with some medication that can, help you live an okay life.
Right. To maintain it.
They're setting themselves up as the solution.
Right. And the interesting thing, if you really look into what metabolic syndrome is, first of all, metabolic syndrome is completely, you acquired it by your life. It's not something you catch like AIDS. You really do. It's transmissible.
Definitely not getting it from the public bathroom.
No, I mean, this is something you signed up for. You acquired it because of what you do in your life. And if you look at it, first of all, they say there are no symptoms. The only symptom is a large waist circumference. So interesting. But what causes metabolic dysfunction is everything that they already have a medication for. So I find interesting. It's high blood pressure, high blood sugar, so it's attributed to diabetes. It is hydroglycerides, low HDL, good cholesterol, and what's the other one? Something else, but it's something else that is super common that they have a fix for already. And then now they're saying that you probably will also have to take anti-inflammatory medication. So right there, there's 6 medications and didn't fix anything.
No, it's just covering it all up.
Completely 100% fixable and you shouldn't get it in the first place.
No, and the crazy thing is all of those things that are, lumped in there, like doctors know that you can turn those things around with diet, lifestyle, exercise. Like they know that, but they don't tell you that because it's not something they can prescribe you. They're I'm not saying all doctors in the whole world are just out there to make money, but as far as pharmaceuticals, it's not something they can make money off of, so that is not going to be their solution. It's crazy to me that patients they don't even ask about diet or mention it for, 95% of the time with these lifestyle issues.
Right. But if you look up metabolic syndrome, there's a million different sites, and most of them are conventional medicine that say you can turn this around, or this is completely preventable by diet, lifestyle, and environment. But take this medication.
This is better. This is faster.
Right. And people are just your mind is trained to think that way. So you're like, okay, I'm at that age. I need blood pressure medication. Okay, I need cholesterol medication, that type of thing. But what I was going to say is, we call what we do. So we say that, first of all, the only way, and this is true, the only way to prevent these issues in the first place, or to turn them around, that's the whole cause and the cure premise, is to live a preventative health lifestyle, is what we call it. So the whole goal, the transformation, is not only do your symptoms go away, but you prevent them from ever coming back with what you're doing with your life. Right. But you hear the word prevention all the time with conventional medicine, and preventatives. That's really a big one now. Like, I'm getting my preventative colonoscopy at age 45 now. That's when they want to start it.
Right.
That's going to prevent me from getting a colon cancer. Well, that doesn't prevent you from getting anything, even though they call it prevention. That just is looking for polyps or something. And then they can say, okay, you have the first signs of it. So the prevention method is to now cut those out, Right. So the word prevention right now is a completely mirrored effect. So when we say preventative health lifestyle, or our certification training is called preventative health practitioner, we're truly teaching you how to prevent these things.
Right.
And never needing medical intervention. You shouldn't need medical intervention unless you have an accident or a serious health problem, that kind of thing. So that's what we mean. When you hear it from a conventional side, it means early detection.
Right. It doesn't prevent anything. A mammogram doesn't prevent cancer. It's actually
It causes cancer because of high radiation, but it can find something early. So just keep that in mind when you're thinking about prevention or preventatives. There's a big difference on whichever side of the street you're listening to. So I'll go through I went through, and we always say we've helped who knows how many people at this point, thousands of people.
Yeah.
But again, and what we said in the beginning, every single person we've helped, and including me, because I always talk about my story, everyone's story is unique. Your story leading up to when you got sick or decided to take action, your life is unique to you. Your symptoms that you've been experiencing along the way are unique to you. So it's like I like to say like a snowflake or a fingerprint, or a zebra. Right. No one is the same. Everybody is completely unique in how they're presenting these problems.
Right.
But so their whole health journey is unique to them, but the outcomes, if you do the right recipe, like I was mentioning, are all the same. So everyone is getting better. So I tried to take some examples of, like a man, a woman, a child, an older person, a young person, middle-aged person that we've worked with over the years, to show you that it's all unique leading up to doing the right things. And then they all were able to get better. So when you feel alone in your situation and we say you're not alone in your situation, that's what we mean, because we've seen it all.
Right.
Outcomes are literally
Yeah.
all the same as long as you do that recipe, the whole recipe, like I didn't say it, but I'm gonna say it now. You do the recipe for the blueberry muffin, put it in the oven. What do you get out? A blueberry muffin. Everything.
Right.
So it's the same idea.
And if you want the best blueberry muffin, you go to the best baker who's
Right.
done it a million times and gives you that recipe with all the little tweaks and all of the little, secret tips. you
Do you
know,
want the gourmet blueberry muffin or do you want the Kroger's blueberry muffin?
right. Because you could take all the same ingredients and how you put them together and the temperature and the time, it's going to come out different.
Right. I mean, technically, you could tweak the blueberry muffin recipe and put it in at 300 instead of 350, and you'd still get something that kind of
Right.
tastes like a blueberry muffin, just a different one.
Yes.
And again, that's like the transformation. I always
Exactly.
get on these weird analogies. The transformation of the blueberry muffin. Do you want the squished blueberry muffin that doesn't rise and tastes
It
like two?
doesn't have any blueberries. It's actually just food dye and extra pieces of dough put in there to look like a blueberry.
Right. Or the gourmet blueberry muffin. Here's a funny story that happened to me. It just popped in my head. But it's kind of along these lines. So when I was like 20, I can't remember if I had just gotten married or was still dating my high school sweetheart. I was young. And so I was eating at their family for Thanksgiving for the first time, and I made pumpkin pie. So clearly I kind of followed the recipe because it looked like a pumpkin pie. These are people I didn't know very well. And they're like, this is so good, Kendra. I love this. And then I tasted it. I had forgotten to put sugar in it.
Oh,
Yes. So it was so bad, but it looked like
it was a healthy version.
yeah, now I know it was, but at the time I was horrified. But that's a good example of
Right.
if you do the recipe 60%, you're going to get 60% of the results.
Right. And you might look great, but internally, not so great.
Right. So anyway. Okay, so I'm just going to go through these. I think I have 5 examples. So the first example I have, this is a man that we worked with, a young man. He was only 42. He was a truck driver. So, a truck driver has a job that's actually may not be stressful to the person if they enjoy it, but it's stressful to the body because you a long time, many
a
hours.
lot of toxin exposure from the fumes.
Right. Toxin exposure. It can be bouncy. It's hard to eat healthy on the road, especially long distance. And that's what this person was. So anyway, when he came to us, really nice man. I liked him a lot. He's only 42. That's young, 42. So he had high blood pressure, heart problems. He had joint pain. He had a lot of pain. He was pretty overweight. He was on 2 different medications for, trying to treat his symptoms. He had chronic fatigue, which is not good.
Terrible for a truck driver.
That's kind of scary for the rest of the drivers and him. Restless leg syndrome, that's very common. IBS and kidney problems. Excuse me. And a lot of times we talked about this in the last podcast, a lot of times people can pinpoint when their symptoms got really bad.
Right.
We were talking about a big stressor that comes into your life. He had felt so bad for so long, so many years, that he couldn't even pinpoint. He had no idea. So he probably had not felt good most of his life. And the symptoms had probably gotten worse.
And it was just to the point where it was affecting like his whole life. Like his job almost is impossible because he's,
Right.
IBS and fatigue are not really conducive to long road trips.
Right. I mean, imagine, okay, fatigue would be terrible, but imagine having IBS if you're a long haul truck driver. I mean, terrible. How stressful that would be. And he had kids and a wife, he had a family to support. So anyway, he went through the program, and he was great because it is hard. I will say some people's lifestyles, it is hard to do what we ask you to do. And for a truck driver, that's hard, but he did it. He managed, he got creative, and he did it. And by the time he left, every single one of these problems had gone away, and he'd gotten off of both medications,
Yeah,
his own. So that's pretty amazing, right? That's quite the transformation of his
it
life.
is. And he was like a 6-month person that we worked with, right?
Yeah, this was over 6 months. I should have looked to see where he was at 3 months, but like we always say, usually at 3 months, most people are feeling so much better. They have a handle on this new lifestyle. They're feeling confident to keep going forward, because remember, most of the time, this has taken you always. It has taken
Always.
you years and years and years, and many times your whole lifetime to get to where you are feeling bad enough to seek help.
Yes.
So you can't expect, and it goes back to that, a pill or a product, you can't expect that magic bullet, because it took your whole life or many, many years to get to this point. So it takes time to then heal.
You can see change, but you can't expect a full, complete transformation in
right.
that.
Yeah. So this was 6 months. So I'm sure he had a long way to go as long as he kept up this lifestyle. But when he left, he was so happy because it had transformed his whole life. And it wasn't just that now he felt really good. It trickles down. It affects your family. It affects your spouse. It affects your children, your relationship with your children, what you're able to do, your productivity with your job. So many things are affected by these chronic conditions people are experiencing. So he was 42. So then we have, this is another young man. He was only 30. So this is a very young man. He came in, depression, anxiety. He couldn't sleep. He had migraines, arthritis. He's 30.
Yeah, that's so odd how that's getting diagnosed so young now. And they're putting people on these awful, awful medications.
Right. And they make it sound normalized. Well, I'm 30. 30 is young. 30 is when I had my first child. I mean, that's a young person. He had all kinds of GI issues, abdominal spasms. So he was in some really severe pain a lot of the time. It would just come on. Multiple chemical sensitivity. So he was one of those people that, if you go somewhere like Target or somewhere where there's a lot of smells, or what's that store at the mall? Bed Bath, or not Bed Bath and Beyond, the candle store.
Oh, Bath and Body Works.
Yeah. Somewhere where like that, where it will throw you, like literally throw you off.
Right. Not just you don't like it, but it like has a huge physical impact.
Right. It physically impacts your symptoms. You'll have flare-ups. It's awful. I always had that as well when I was young. So he had that. He had UTIs. He had light sensitivity. So when he came into our office, first of all, he was in a wheelchair too, because he was so weak and the muscle pain. So he just could not walk. And it wasn't like he wasn't paralyzed. It wasn't anything like that. It wasn't a structural issue. His body was not working for him. But then he would come in and he had to wear the, black glasses like people that are sight impaired wear, where they come all the way around. And we had to turn off the lights. We had to close the blinds because he was so light sensitive. So that he was always, and I've talked about him before, because his turnaround, his transformation was so amazing.
The visuals of him are just like,
right.
You don't have to be in health industry whatsoever to have seen like a before and after and know that he got healthier.
So if you picture somebody in a wheelchair, I mean, he was just slumped over, these black glasses on, we're turning off everything in our practice, and but that last day he walked into our practice and he didn't have to wear the glasses, and he did not have to have the lights turned off or the blinds closed. It was amazing transformation. And that's what I mean by transformation. And can you imagine what that did for his life? Because when he came to us, he said he barely went out. he was immobile pretty much. He had to stay in his apartment. He had to have the windows closed. So I remember, like, I don't remember, 3 or 4 months in, he was starting to be able, he could go to the park. I mean, imagine what that did for his life, just to get out and be able to be in nature and not be in such physical pain, or the light, paining him. It was just amazing. So that's just another example. So keep in mind, sorry, my dog's in here. She just made a really weird noise. So those were both men, 42 and 30, young. So this,
And they had some overlapping symptoms, but the things that were most acute were different. And they did the same thing. We put them through the same process to get the results.
right. So if you think about, so the disease tree, so the symptoms that I just explained from both of those men, completely different, right? So that was their branches of their tree. That what was causing their symptoms, even though they were completely different lifestyles, different ages, different symptoms, everything about their experience was different and unique to them. The roots were the same. So we walked them through the same process, like Jenny said, and then they both had amazing transformation, amazing outcomes. So here's another person. This is a woman, and she was 67 when she came to us. So a lot of times people think 67 old, and a lot of people get into their head that once you get to a certain age, this is just should be normal for you, and they don't even think about the fact they could resolve it. We've worked with people, I mean, personally, and I'm sure other practices have as well, but I think our oldest person was 85, and they still turned things around. I mean, if you think about, your body can heal until the day you die, really, or maybe closer to when you're given up. But almost to the end, you can heal, you can turn these things around, and maybe you never get back to 100%, but your quality of life can get so much better. And that's what we mean when we are always talking about optimizing your health. So anyway, this person, a woman, 67 years old, she said that she had been experiencing health issues her whole life. Like, she didn't ever remember a time when she didn't either. And she's one that you can really track, where she had health issues, she had things, and then she had more things coming in, and then she started having surgeries, and it just kept accumulating as she got older. And it also shows you that if you don't take action when you're already symptomatic, you're on the road like her, where it will just keep accumulating and accumulating.
And sometimes when you're really sick, really young, that is hard for you to imagine a different way, because you've been taught since you were young that you go to the doctor, you get a pill, or you get a surgery, and that might make things okay for a little bit, but they're definitely going to get worse, and you're definitely going to have to go back in for more stuff, and it's one of those things we try to get that message out there, that there's another way of doing things. Like, you don't have to be stuck in that cycle.
Right. And another thing that people experience along with that is people that have been sick since childhood. We always tell people to imagine what's your goal? What do you want to feel like? That type of thing. But they don't know what it is for them. Like, they have no idea how they could feel, because they never felt that way. So we like to then have, when people do start feeling better, and a lot of times better than they ever have, then we like you to reevaluate your life and redo your goals, because now you can imagine bigger goals. But there's so many people that just, they have no idea there's more.
Right. They just don't want to not get more sick. Like, that's usually those type of people. Their goal is just to not get worse. They can't even imagine that they could get better. So that's, I love watching that, when people all of a sudden, like, all these possibilities open.
And that's a big one. You see a lot where people all of a sudden, the world, we talked about that a lot. Like our retreat that's coming up, we were talking about, that's just kind of the next level. And then your world just kind of opens up for you, where you didn't even know those possibilities existed. But anyway, this woman had, when she got to us, She had IBS that she'd had for years, arthritis, allergies, sensitivities, mood swings, these emotional issues that people are having is very common. So she had mood swings, depression, anxiety. She had insomnia, fatigue, on 6 different medications. She had high cholesterol, high blood pressure, acid reflux, Hashimoto's, diagnosed Hashimoto's, restless leg syndrome, yeast infections, UTIs, and endometriosis. And she had 2 children when she was younger, but she had all kinds of issues, as far as endometriosis and
Right.
having a hard time conceiving and things like that too. So this was just where she was when she got to
Right.
us.
And this is where she is symptomatically and quality of life with all of that medical intervention and being on all of those prescriptions. This is still where she's at.
Right. Yeah. So think about that. So she had, I should have wrote down how many surgeries, but I think she
It
had
was a
had,
lot.
yeah, 3 or 4 surgeries.
Yeah.
Um, I think she had gallbladder out, appendix out, maybe a hysterectomy. She had had some kind of female surgery. And then something to do with the endometriosis, over the years.
Right.
And yeah, so she'd had those surgeries that are supposed to make you better or prevent. And then, 6 different medications, high blood pressure, high cholesterol, all the things. And then she's this sick that she's coming to us.
Right.
It's a great example of how maybe she would have felt worse without these. I don't know, but it's clearly not preventing or resolving or restoring her health, which is always our goal. So anyway, by the time she was done, actually, she's one I remember her 3-month, because actually I think she was only a 3-month person. Because one of her biggest issues coming in was the IBS. Because if any of you have IBS that are listening to this, it is terrible and it does affect your whole life. You always have to know where the bathroom is. A lot of times people have to have a change of clothing. I mean, it's just awful.
Right. If you've not had it or have anyone close to you, imagine having a stomach flu all the time.
Right.
Just constant.
Yeah. And so her IBS was gone. Most of her symptoms were gone. She was off all her meds by that time. And again, we personally in our practice, we don't prescribe or unprescribe medications, but we get you to the point where you feel empowered enough to either start coming off of them yourself or work with your doctor,
Because the point of them is to cover up a symptom. And if those symptoms are going away, you don't need to cover it up anymore.
Right. And all medications are toxic.
Yeah.
They just are. So they fuel that, if you probably can't see the tree, but one of the roots that adds to disease is the toxic root. So medication actually fuels that toxic root. So you need to get off of those. And plus, a lot of times it's the only way to figure out if your symptoms are gone. But anyway, she was able to get off of all of them, and all of this had gone away. She was so happy. But then she had one spoonful of Nutella. It's that one thing, and it completely set her back, and symptoms came back. Not all of them, but
No, but she was at that point, that 3-month ish, that people, their symptoms are going away. They're feeling so good. So they just think they can do anything when they haven't given it enough time to really build that foundation that can deal with that kind of stuff.
right. And that doesn't mean, okay, now you're back to square one. It simply means, if you listen to us about the threshold bucket, it just means that was one more thing coming in, caused symptoms to come back. And now all she has to do is just do a little reset and they'll come back down. But then you need to give it time. So,
More time.
but it was a good example for her and in our little, what we're doing here. But anyway, she was 67. So anybody that thinks that they're older and can't heal, that's not true. You can't. And look how much she had. And it all went away. So this is another person. This is a woman that was 30, and her main issues were all like women issues. So she was born preterm as a child, and she did have a car accident. So after those, she had some symptoms, but not really. Like she felt like she was pretty healthy and strong, and
Right. She
had
just
four.
never had like thrived, but she didn't think she was unhealthy.
Yeah, she thought she was thriving, so she felt pretty good. But then when she came to us, the problem was that she could not get pregnant. She had very long periods. She had a very irregular menstrual cycle where she would go months with nothing. And then when she did have one, it would be long and painful. She had all kinds of hormone issues, endocrine issues, fertility issues. She and her husband had been trying to have baby for a long time, couldn't get pregnant, trying all kinds of things. She did have chronic fatigue. That was a big issue for her, and just an overall sense of unwellness. So I think there are a lot of people that, we're always talking about symptoms or chronic health conditions, but there are many, many people that just feel unwell. Like you can't quite pinpoint it, but you don't feel right. You don't feel good.
Yeah.
So anyway, it was that type of a thing. And then she had a lot of just mental sluggishness where, she liked to say in high school and college, she was, top of the class and all those kind of things. But then she had gotten to the point by the time she was 30 where she just had a lot of brain fog and just she felt like everything was kind of slow and
Yeah.
it's not processing. It was discouraging for her because she'd always been, real sharp is how she described it. So anyway, after she went through, excuse me, by the time she left us, the periods, the hormonal issues had kind of gotten back into balance.
Right.
She wasn't having those issues anymore. The mental clarity had come back. Her energy had come back. All of that had come back. And then 2 years later, because again, it takes time. And that's the one thing we don't know. You don't know. Nobody knows how much time it will take for you as an individual. But 2 years later, we got a phone call saying that she had just had a brand new baby, healthy baby. The whole pregnancy was healthy. Baby was healthy. She was healthy. And this is someone that had tried for years and years and years to get pregnant. And we've seen that a lot too, where people can't get pregnant.
Yeah, your body knows. Like that's
Right.
so hard on a body. It does its best to keep you alive, which means it does its best to prevent that from happening.
Right. Because if you think about it, a pregnant woman, baby takes a lot of your energy. It
Mhm.
takes a lot of energy. It takes nutrients, because it's the baby. You're growing a life. So think of what that takes from,
Needs.
from a woman that needs. So if you are sick, if you're unwell yourself, um, first of all, if you do happen to get pregnant, that can be the worst thing for you.
Right.
We see that a lot too, but then sometimes your body is just like, no, we're not doing this, and you just can't get pregnant. And we see that all the time. We've seen that so many times. So anyway, that was a good example. And then we always love hearing years later feedback because it does, when people leave us, they're feeling good. But then over a few more years, it's amazing what else happened, just better
Right.
and better.
And that's kind of where our community came from because we wanted to be able to keep people in our, I don't know, ecosystem long term. But we don't need, most people can't afford to have that like paid coach mentor for the rest of their whole life. And you probably don't need that because we want you to be empowered. But yeah, that's why we have people that can be in the community and they can stay there and you get that support and you have those resources for years and years and years.
Right. Yeah, it makes a big difference in success. The success
Yeah.
for you great down the road. So this person, I only have two more, but this person is a young woman. I think she was 34. And she came in with her baby. So her baby was 9 months, but the mother was having all kinds of health issues. Similar to what we're talking about. She had GI issues. She had chronic fatigue, brain fog, all of those things, low energy. But then the baby, ever since it had been born, very underweight, failure to thrive, just didn't act like a little girl. I mean, she was 9 months old and she was behind, super small. She didn't smile. She would hardly eat anything. She just didn't have any expression. I mean, it was just, she didn't see, you could tell there was something not right. So they both came in and started doing all the right things. The mother, all her symptoms resolved. And then the baby, it was amazing. She put on all kinds of weight. She grew, she started smiling. She caught up with where she should have been at 9 months. It was really pretty amazing. And then to top it off, she ended up right before she graduated with us getting pregnant.
Right. Which had been really difficult for her with the first child.
Right. So she had the first child. It had been very difficult to get pregnant, and finally got pregnant, and then had this baby that was, had
Not healthy.
complications at birth, failure to thrive, all those things. And then she had been trying to get pregnant again, but because she was so unwell, she couldn't. So then once she herself got healthy, she was able to get pregnant again without even trying. She didn't even
Right.
trying at that point, but she was so happy. And then that baby was born healthy,
Right.
no
Much different.
Right. Big difference. And that's something else just to think about is the baby, or I'm sure we mentioned this before, but the child's microbiome comes from the mother's microbiome. That's where you first get your microbiome. So if the mother is very unhealthy,
right,
and it's a compromised microbiome and metabolic dysfunction, you immediately pass that on to your child. So now they're just born and they're already starting off life with this. Something to think about. Another reason to get healthy first.
yes.
And then my last one, this is an 18-year-old, and we see a lot of people around this age,
Yeah.
say 18 to 21. That's a really common age where, they've probably been sick their whole life, but they've finally gotten so bad that now they're probably complaining to their parents. Their parents are trying to, find a resource to help them get better. But that's probably why we see so many. But this particular,
Right. And you start thinking about, like, at that point, as a person, you start thinking about your future and what you want to do and what you're going to be able to do. And then if you start to realize that this is holding you back, oh my gosh, and you're just starting your life. So I think that that's an age where people themselves start to realize that impact.
right. And you're more on your own. Like, even if
Yeah.
you're just going to college at that point, you're more on your own. And so it's more apparent that you're unable to keep up.
Yeah.
This particular kid, he had just graduated from high school. So he was ready to start his career. His family had a family business and that he was going to go into, but he literally could not work. So he was 18, and to look at him, he's a really good looking kid. He was like one of those people that you would think it's going to go do great things. But when he first came in, he was, I don't have anything gray. Here, this pen is gray. He was this color. I'm not kidding. His skin was this color. And he would just sit there like this. And he would just kind of, actually didn't look at you because he never made eye contact, but he would just kind of look over, never talked, gray, no energy, couldn't even sit up straight. And what he was saying was he had no energy. That was one of his things. He had ulcerative colitis really bad. That was his main thing. So GI issues, no energy. He couldn't conversate with you. He couldn't hold a conversation, even to answer questions. Like, his mom had to do it for him. And he couldn't even hold a job.
Right.
So he just was staying at home. I mean, he's 18.
Yeah. And that definitely took a toll on him mentally. Like, he just felt kind of like useless at that point.
So he had all kinds of emotional issues. He had been really into sports. He was probably real popular. Like I said, I think he was in sports and good looking. And, he ended up, once we got him better, he had a really nice personality. So I bet he originally,
right.
But it was impacting his entire life.
Yes.
So then again, it's transformative of his life. It wasn't just that all of a sudden he felt better and this ulcerative colitis was, cleared up. He didn't have the GI issues, but it completely transformed his life and what he could do. And imagine being a teenager and you've got ulcerative colitis. How could you go anywhere? I mean, think about what teenagers do. They eat all kinds of junk and they go places, and stay out late, and he couldn't do any of those things because you never know when you're going to have just a complete accident. So completely transformed his life. That was pretty amazing to see. And by the end of working with us, his color was back. He was back to a normal color. He would look at you. He would sit up in his chair. You could have a conversation with them. So that was pretty amazing. So that's the end of my examples. But the point of this, going through these, is just to see again that everyone is having different issues,
Right.
but not alone in their situation, because it's still the same causes causing those issues.
Right.
And as long as you address the causes, root cause, then you can turn that around, transform it. And then part of the transformation is then preventing anything from coming back.
Correct. Yeah.
That's a big part of it.
So you might, if you're listening to this and you haven't worked with us, you might have like resonated with a little bit of this person's story and a little bit of that person's story. And oh, yeah, but I'm not exactly like them. But that's okay, because that's what we're trying to get across here, is that you don't have to have, these exact group of symptoms in order to turn something around. You don't have to have this label of this disease in order to take this action. We have a plan of action, we have the knowledge, we have all the tools you need to move you forward in the most optimal way. Again, there are other programs out there. Our point is really just that you have to take action, and you are not alone. There is a solution for you. It's just not going to be one single magical thing.
Right. You have to get over that. So you have to get over the fact that there is no magic bullet.
Yeah.
And I'm telling you, I have not heard ever in my life of more magic bullets than right now.
I know, it's crazy.
So much. It's insane. Yeah. Everywhere I look, there's all these magic bullets. So number one, get that out of your head. There is no magic bullet. No. You also have to know that nobody can make this decision for you. Right. You have to make the decision to invest in your health. Yes. And where a lot of people they know that they're just not 100% for everyone else.
Yeah.
You have to be able to get over that stumbling block of thinking it's selfish for you to want to focus on yourself, because that's the only way you can take control of your own health and then be there for everyone else. Right. Those are two big things. Third thing is you have to be decisive. That's really hard for a lot of people. And right. A lot of people that are having issues like these, mental sluggishness, you're depressed, you're anxious, your mind is not in a good place. And that is very common across the board. But somehow you have to pull up that strength with yourself to be decisive in order to say, yes, I will do this for myself. Right. And once you do all those things, you really can do it. You can get better. That's what we're telling you. There's hope. It's not even hope, because hope is not an action word. It is an answer, and you can attain your goals or your transformation or whatever you want out of your life, but you will never ever get there. You will never even start. And it's not even this. You can't start anything unless you choose to do it and you take action and make a decision. Anything in your life. So those are the 3 takeaways. It is. But especially for health, you've got to do that for yourself. And that's like the first step to being empowered in anything too, I think. You can't wait for somebody else to say you can do this, or you can't wait for magic anything. It just doesn't work that way, but there is an answer. So that was really the point of it. And you can heal at any age. Right. No matter what is going on, no matter who you are, it doesn't matter. You can. Your body has the ability to heal if you take away the interference. Right.
So, if you've already worked with us and you've had that transformation and you're, sticking to it, good for you. If sometimes it's hard for people to like share that with their friends and family, all of those little details. So, if you know someone that you feel like is kind of like where you used to be, then share something like this. We have, other podcasts and recordings that have specific interviews with client transformations, like kind of testimonials. So you can share those. But this is a good one to show just in general. There's so many different ways to be unhealthy,
Mhm.
but there's only one way to get healthy.
Right.
You have to take this action. You have to change your lifestyle in order to turn around and prevent future dysfunction from happening. So, you know, we just want to get that all of this out there, because this is one of the hardest parts of what we do, is actually getting people to understand there's a different option. They're not stuck. We can help, so
There is an answer because it is constantly beaten into everyone's heads. So you hear it everywhere. If you're having symptoms and you're going to the doctor, they're telling you there is no cure. You cannot turn this around. You hear that all the time. And so that's what people believe. So one of our biggest takeaways that we want you to understand, or like Jenny said, if you already know this since you've worked with us before, to share this with other people, is that there is an answer. There truly is, because I think that's one of the biggest things with people. And I felt that way when I was sick. You think you are alone and you think you don't know what to do. You just feel alone in your situation. So we definitely want people to know there is an answer no matter what. And it's always the same. It literally is. And it's not one thing.
no.
It's a roadmap.
Yeah.
The other thing I was going to say, this is how we know we have guaranteed outcomes with everyone we work with. We know they will get better as long as they do it. But also, just to throw in this at the end, we have two programs. We have our signature program, but we also have our preventive health practitioner training and certification. And that's how we can guarantee that those people, like if you become a PHP, you know that when you work with people, they will have these positive outcomes because you're walking them through the same system.
Yes.
You just learn it and implement it. So, and eventually this will just be the norm.
Yeah. Hopefully that's the idea.
Your birthright is to be a healthy person.
Right.
Everyone should be born as a healthy person
And have control over their
right.
outcomes.
Right. But it's just, we're living in a time that is so much coming in that people are just sick, but that's not the way we are designed to be. Right. So there is an answer. So hopefully this helped anyone listening, or it resonates and you can share it. But yeah, the more people that learn this, the more we will finally turn this around. So share it, like it, subscribe.
Yes.
So that's it. And then we'll see you next week. Okay. Have a good week.
Bye, everybody.